The topic for today's lecture is about cardiovascular drugs. So the first lecture will be about the cardiovascular drugs, followed by the second lecture which will be about autocoids. So first we are going to see the different category of drugs which will act on the cardiovascular system. So these are a broad category of drugs. So they are broadly divided into 5 subcategories. The anti-anginal drugs, diuretics, antihypertensives, cardiac glycosides, anti-arrhythmic drugs. So we are going to divide all these 5 subcategory of drugs into 3 parts. So today we are going to see the first part, and in the next week we are going to discuss about part 2 and part 3. So coming to the anti-anginal drugs. So first we must know what do we mean by angina and what actually happens during an angina attack. Then we can understand how the drugs act for treating or for relieving angina. So angina is nothing but it is a sudden severe pain in the chest, or you can say discomfort in the chest. Sudden severe discomfort or sudden severe pain in the chest is known as angina. In simple words, it can be defined as severe chest pain. Why does this chest pain happen? It happens because some part of the heart is not able to receive enough oxygen from the blood. So it is finding difficulty to pump or finding difficulty to work. In such situations, chest pain arises. So this severe chest pain is due to an imbalance between the oxygen requirement of the heart and the oxygen supplied to the heart. So like all the other organs of the body, all the other tissues and cells of the body, as they require oxygen to function, heart also requires oxygen to function properly. So heart is also an organ. It also requires oxygen from the blood to pump. But if the oxygen supply to the heart is not enough, or if the oxygen supply of the heart is not, it is in an imbalanced way, then it leads to angina pectoris. It leads to sudden severe chest pain which starts from the neck, extending to the jaw, then to the back and the arms. So this is how the pain radiates. It starts from the neck, jaw, back and the arms. And these ischemic heart diseases, these are all classified under ischemic heart diseases. These are the most common serious health problems which the people are facing worldwide. So basically the primary cause is due to the imbalance between amount of oxygen that is required by the heart and the amount that is actually supplied to the heart. Next, coming to the types of angina. Now, angina are of many types depending upon how they arise or what is the actual problem in them. So the first type is known as stable angina or typical classic or atherosclerotic angina. So these are the names of the first type of angina, that is stable angina. In this type of angina, the imbalance occurs when the oxygen requirement increases as during exercise. So sometimes when we are doing exercise or when we are, getting down the steps or going up the steps, or if you are doing any physical activity, the heart requires more oxygen to work properly. So in such cases, pain starts in some people. That is known as, that type of angina is known as stable angina. So the myocardial oxygen requirement increases as during exercise, and then suddenly this type of angina starts. That is known as stable angina. Next is Prince-Metal variant or vasospastic angina. Now in this type of angina, there will be decrease in the oxygen supply. But why is there decrease in the oxygen supply? Due to coronary vasospasm. That means the blood vessels of the heart, blood vessels which supply blood to the heart, they are constricted, vasospasm. So like other organs, as I told you, heart also requires oxygen. So blood will supply oxygen to the heart. So there are blood vessels which are known as coronary arteries, which supply blood to the heart. So there will be constriction of those coronary arteries. Thereby what happens? It leads to decrease in the oxygen delivery to the heart. So in such cases, what will happen? Again, there will be chest pain. This of angina is known as variant angina. The third type is the unstable angina. In this, episodes of angina may arise anytime, even if the patient or the person is at rest. There might be an angina attack, or if he or she is doing physical activity, there might be an angina attack. So anytime angina attack might be there, and every time there will be a change in the character, frequency, and duration of chest pain. So every time different type of chest pain arises, different frequency, different duration of chest pain arises. So these are the three different types of angina: stable, variant, unstable angina. Next comes the anti-anginal drugs. Now we know that angina pectoris is caused due to deficiency of oxygen provided to the heart. So what are the drugs going to do in order to either increase the oxygen supply, or they should decrease the workload of the heart? If the heart is working more, it requires more oxygen. When more oxygen is required, that oxygen is not supplied to the heart, leading to angina. So the anti-anginal drugs, basically they concentrate on reducing the workload of the heart so that the heart should not require more oxygen. That is the basic aim of anti-anginal drugs. These drugs decrease myocardial oxygen requirement by decreasing the workload of the heart. They decrease the heart rate, they decrease the blood pressure, they decrease the contractility of the heart. That is, they decrease the force of contraction of the heart. So when they are decreasing the workload of the heart will not require more oxygen to pump or to work. So this is the basic mechanism by which anti-anginal drugs act. They are classified into three types: organic nitrates, beta blockers, calcium channel blockers. So nitroglycerin is an example of organic nitrates. Beta blockers, we have atenolol, propranolol, metoprolol, etc. Calcium channel blockers, we have amlodipine, diltiazem, nifedipine, etc. So these are the drugs which are classified under different categories depending upon their mechanism of action, how they are acting on the heart. And altogether, the main aim of these drugs is to reduce the workload of the heart so that the heart does not require more oxygen to work. Apart from that, risk factors can also be reduced in order to, as a treatment for angina, such as stopping of smoking. First, coming to the first category, that is organic nitrates. So nitroglycerin we have studied many times earlier. This is the drug of choice for relief of acute symptoms of angina. So it is an emergency drug and it is used to relieve severe sudden chest pain. It can be administered either sublingually or as a spray also. Quick onset of action is seen and short duration of action will be there. So very quickly it will start acting, but for a short period of time. So what do this drug do? The important action is it causes relaxation of vascular smooth muscles, vasodilation of veins and arteries. So what it will do, it will dilate the veins and the arteries, and it what do you say, relaxes the vascular smooth muscles. Thereby, what does it do? It reduces the workload of the heart. If the veins and the arteries are relaxed, then more amount of blood will not reach the heart and the heart will not have to work so much to pump that much amount of blood. So it relaxes the veins and arteries such that the blood does more amount of blood does not reach the heart and heart should not find it difficult to pump. Apart from that, it also relaxes the non-vascular smooth muscles such as bronchial, GIT muscles, etc. So it can also be used in the treatment of spasms of the esophagus because it is causing relaxation. Spasms mean uncontrolled contractions. So if there are contractions in esophagus, then it is also used for such type of cases. At therapeutic doses, nitroglycerin has two major effects. First, it dilates the veins, resulting in pooling of the blood. So as I told you, it will dilate the veins so that the blood remains in the veins for some more time, and it does not, all the blood does not rush to the heart at the same time. So this diminishes the venous return to the heart, reduces the work of the heart. So dilating the veins causes pooling of blood in the veins so that the blood, the amount of blood does not reach the heart, and which reduces the workload of the heart. Next important function is, apart from that, it also dilates the blood vessels of the heart itself, the coronary blood vessels, so that more amount of blood reaches the heart so that more amount of oxygen can be absorbed by the muscles of the heart and help it to work. So it is causing dilation of all the other veins so that the veins do not pump blood to the heart, all the blood to the heart, and it will also dilate the coronary blood vessels, that is the blood vessels of the heart itself. So dilatation means what happens? Increases the area and more amount of oxygen can be absorbed by the heart. So for an ongoing attack of angina which is precipitated either by exercise or emotional stress or anything, immediately sublingual or spray form of nitroglycerin should be given. It is an emergency drug. So it decreases the oxygen requirement of the heart by reducing the workload of the heart or by reducing the cardiac work. Onset of action. So we have studied earlier that the onset of action of nitroglycerin is very quick. So it will be 1 minute for nitroglycerin and more than 1 hour for isosorbide mononitrate. These two drugs are classified under organic nitrates, but the onset of action is different. So very quick onset of action is seen for nitroglycerin, and after an hour of giving isosorbide mononitrate, it will show its action. First pass metabolism is seen with these drugs. That is why especially nitroglycerin is given sublingually or through a transdermal patch. Now, because it causes dilatation of the blood vessels, what will happen? The blood vessels of the brain are also dilated. Meningeal arteries are also dilated, which might lead to adverse effect, which is known as headache. So, because of the dilatation of blood vessels, it might lead to headache. Next, because the veins are dilated and all the blood is pooling in the veins, there are chances that enough amount of blood may not reach the brain. So, especially while changing posture. So, it might lead to postural hypotension. Now, because the blood, enough amount of blood is not reaching the heart rate will also slow down. The workload of the heart is decreasing. That means the heart rate is also slowing down. But there will be a reflex mechanism. If the heart rate is dropping too much, the reflex action will be there and it will lead to reflex tachycardia. Tachycardia means increase in the heart rate. So there will be a reflex mechanism which leads to increase in the heart rate. Next category is beta blockers. So you have studied these beta blockers earlier in your autonomic nervous system. All right. So this is just a revision of that. You know that beta blockers, they cause a decrease in the heart rate and decrease in the force of contraction. So again, the same thing. These drugs are also, the goal of beta blockers is same to the goal of organic nitrates. That is, they are also concentrating on decreasing the workload of the heart. How are they doing that? By decreasing the heart rate and decreasing the force of contraction of the heart. So they are not allowing heart to work too much. If the heart does not work too much, then oxygen will not be required too much. So exercise, emotional stress, everything can lead to angina. So a decrease in heart rate and force of contraction can be helpful in the treatment of angina. So with the beta blockers, the pain of angina can be reduced by reducing the cardiac work. They also reduce the frequency and severity of angina attack. These agents are useful for people who suffer with myocardial infarction also. Myocardial infarction, I think you all know, a particular tissue of the heart does not work. It gets infarcted because oxygen supply was not proper to the heart, right? So in such cases, what will happen? That part of the tissue will die. So the heart cannot work much because some part of the heart is dead now. So it is necessary to check that the heart work, sorry, the cardiac work should be low because some part of the heart is already not working. So heart cannot work up to the mark. So it is necessary to reduce the work of the heart. So in such cases, in myocardial infarction also, beta blockers can be used. Beta blockers are for long time therapy. They cannot be used immediately. If there is a sudden angina attack, then beta blockers will not act so quickly. So at that time, nitroglycerin is the drug of choice for treatment of emergency angina attack. even if the patient is taking beta blocker for a long period of time but still suddenly develops angina, then in such case also nitroglycerin is preferred. Now, because these are beta blockers, they cannot be given in people who have asthma, diabetes, bradycardia, and chronic obstructive pulmonary disease. Now, why it cannot be given? You have to refer your previous lectures. Till now, you must be able to relate why beta blockers cannot be given in asthma, diabetes, if the person is having severe bradycardia and chronic obstructive pulmonary disease. So you have to know that. I am not going to explain you. Refer to your previous lectures and let me know in the next class. Calcium channel blockers. The third calcium channel blocker. Calcium channel blocker. That means these drugs, they block the entry of calcium inside the cell. But what will they gain if calcium is not coming inside the cell? Calcium is responsible for causing contraction. Muscle contraction is basically dependent on the calcium ions. So these calcium channel blockers, they will block the entry of calcium inside the cell. So when calcium is not coming inside or not allowed to come inside, it will have a good effect on the smooth muscles also and the cardiac muscles also, because these muscles will not be able to contract too much, and we need that heart must not work more. So the calcium channel blockers protect the tissue by inhibiting the entrance of calcium into the cardiac cells as well as the smooth muscle cells of the complete body as well as the heart. So they are arteriolar vasodilators. Calcium is responsible for contraction. Now calcium is not able to come inside the cell. Thereby it leads to vasodilation, which leads to decrease in smooth muscle tone and vascular resistance. So everything is relaxed. And then again, the heart, the walls of the heart are also not contracting too much, thereby reducing the workload. So among the calcium channel blockers, verapamil mainly acts on the myocardium, that is the heart, whereas nifedipine acts on the smooth muscles of the periphery. Diltiazem is the third drug which is intermediate in acting. It can act on the myocardium also and it can act peripherally also. So variant angina, which is caused by coronary spasm, either at work or at rest, rather than increase myocardial oxygen requirement, it is controlled by organic nitrates and calcium channel blockers. So variant angina, because it is caused by coronary spasm, that means constriction of the coronary blood vessels, so it can be controlled or it can be treated with those category of drugs which are causing dilation of the blood vessels. So what are those category of drugs which are causing dilation? Organic nitrates and calcium channel blockers. Whereas beta blockers should be contraindicated in variant angina, because beta blockers are decreasing the heart rate and they are decreasing the force of contraction. But here the actual problem is coronary spasm. So we have to relax the blood vessels. Thereby organic nitrates and calcium channel blockers are preferred. Next, coming to the second category of cardiovascular drugs, that is diuretics. So what are diuretics? Diuretics are those drugs which increase urination. That means they increase the excretion of urine from the body. So these drugs, they basically act in the nephrons. Nephrons are the structural and functional units of the kidneys. So in the complete body, kidneys, they play a major role in maintaining fluid and electrolyte balance. So substances that increase the quantity of urine are known as diuretics. So diuretics increases urination. They increase the excretion of urine from the body, basically acting on the nephrons. Nephrons are structural and functional units of the kidneys. So all the diuretics, they are acting on different parts of the nephron. These diuretics are used for treating hypertension and congestive heart failure. What are the classification of diuretics? They are classified into 5 different categories. Carbonic anhydrase inhibitors, loop diuretics, thiazide diuretics, potassium sparing diuretics, and osmotic diuretics. So there are examples below each category of drugs. So we are going to see one by one what is the what do you say, what is the mechanism of each category of diuretics. So first we will see about the nephron. So you might all have studied nephron in your previous semester. So I'm just showing you the picture of nephron and the different parts. This is the proximal convoluted tubule, distal convoluted tubule. This is the loop of Henle. This is the descending loop of Henle, ascending loop of Henle, and this is the collecting tubule. So why am I showing you this? Because different drugs, they act on different part of the nephron. For example, osmotic diuretics and carbonic anhydrase inhibitors, they act on the proximal convoluted tubule. Osmotic diuretics also act on the descending limb of loop of Henle. Loop diuretics, they act on the ascending limb of loop of Henle. Thiazide diuretics, they act on the distal convoluted tubule. Potassium sparing diuretics, they act on the collecting duct. So these are the different category of diuretics and their different site of action in the nephron. Coming to the first category, that is carbonic anhydrase inhibitors. Carbonic anhydrase is an enzyme. These drugs are inhibiting the enzyme carbonic anhydrase. So what is the importance of this enzyme? Why are these drugs targeting carbonic anhydrase enzyme? Carbonic anhydrase enzyme helps in the excretion of, helps in the reabsorption of bicarbonate. So by blocking the enzyme carbonic anhydrase, it will lead to increase in the excretion of bicarbonate. So they are blocking the enzyme which is responsible for reabsorption of bicarbonates. We do not want anything to be reabsorbed from the kidneys. Thereby we want everything, all the urine to be excreted from the kidneys. So in such cases, the carbonic anhydrase enzymes should be inhibited. If this enzyme is inhibited, bicarbonate will not be reabsorbed and it will lead to excretion of bicarbonate. Thereby it leads to alkaline diuresis. Now alkaline diuresis also helps in the excretion of certain type of drugs. So the weak acid, the drugs which are weak acid, they will be excreted more if the urine has become alkaline. Whereas the excretion of weak bases will be decreased if the urine has become alkaline. It is used in the treatment of edema, in the treatment of glaucoma, and in some cases of epilepsy. Glaucoma is a condition of the eye in which the intraocular pressure of the eye increases. The liquid, the aqueous humor which is present in the eye is not able to drain. So in such cases, liquid accumulation occurs in the eye which increases the pressure in the eye. So in such cases, carbonic anhydrase inhibitors can be used. Adverse effects are tinnitus, that is hearing hearing sounds in the ear, ringing or roaring sounds in the ear, that known as tinnitus. Alteration of the taste might be there, loss of appetite, that means the person may not feel hungry, nausea, vomiting can be seen. And as I told you about weak acids and weak bases, so alkaline diuresis can alter the elimination of other drugs. So it can affect the excretion of other drugs. Next is loop diuretics. So as I told you, loop diuretics, they are acting on the ascending limb of loop of Henle. That is their site of action. They inhibit the sodium and chloride reabsorption in the body. See, when the liquids reach the kidney, it is not the case that the entire thing will be excreted from the body. Even after the waste reaches the kidney in the liquid form, certain amount of salts, certain amount of ions that will be reabsorbed back into the body. So here whenever I am telling you reabsorption, that means those salts will be reabsorbed back into the body in the normal process without any diuretics. When the waste liquids they reach the kidneys, in the nephrons, as the liquid passes, certain salts, certain ions, they will be reabsorbed back into the body, and the complete waste then will be excreted from the body. So these diuretics, they inhibit the loop diuretics, they will not allow the reabsorption of sodium and chloride ions. Thereby it will lead to natriuresis, that means increase in the sodium ions in the urine. So they are not allowing sodium to come back to the body. So sodium will be excreted in the urine. So the urine will become natriuresis, that means the sodium levels in the urine will be increased. These diuretics are also known as high ceiling diuretics. Apart from sodium and chloride, they also increase the excretion of other ions such as potassium, calcium, magnesium, etc. The important drug in this category is furosemide. Furosemide is a widely used and important drug, and it is classified under the loop diuretics. It is present in oral as well as injectable form, and the action begins within 5 minutes after IV administration and 30 minutes after oral administration. So this is how the what do you say, action starts. 5 minutes, it will take only 5 minutes to start urination if it is given by intravenous route. Uses are, all the drugs definitely they will be used in hypertension, they will be used in edema, edema of cardiac, renal, hepatic nature, or edema in the lungs because it is causing excretion of fluids from the body. So any type of edema can be treated. And severe hypercalcemia, it is seen in malignancy. Hypercalcemia means increase in the levels of calcium in the blood. Because this drug is causing excretion of calcium ions, it can be used for the treatment of hypercalcemia. Adverse effects are all the ions are being excreted from the body. So there are chances that the patient might suffer with hypokalemia, that is decrease in the potassium levels in the body. Hypocalcemia, hyponatremia. Calcemia relates to calcium, natremia relates to sodium. Hyperuricemia. Uric acid is not excreted, so it will lead to increase in the levels of uric acid in the body. Hypotension and hypomagnesemia. Hypo always means decrease, hyper always means increase. So in the body, there might be decrease in the levels of these ions. Next is thiazide diuretics. Thiazide diuretics are those diuretics which are acting in the distal tubule. Please excuse me for 1 minute. I am getting a phone call. Okay, I'm sorry for the interruption. So, thiazide diuretics. So these thiazide diuretics, they are acting on the distal convoluted tubule. That is their site of action. And they also reduce the reabsorption of sodium, chloride, and potassium ion. So what will happen? It will lead to natriuresis, kaliuresis. That means in the urine, sodium levels are increased. In the urine, potassium levels are increased. But the important thing is it will cause the reabsorption of calcium ions. So calcium ions will not be excreted from the body. They will be reabsorbed. That is the difference between the thiazide and the loop. So in the loop, calcium is also going off. But in the thiazide, calcium is not going. It is coming back to the body. It is reabsorbed in the body and it shows weak bicarbonate excretion. So it is used in hypertension and chronic renal calcium stones, sorry. So what is chronic renal calcium stones? Now, if the levels of calcium ions are increased in the body, so what will happen? Actually, not increased in the body, increased in the kidney. So accumulation of calcium may in the kidney may lead to the development of calcium stones in the kidney. So what are these drugs doing? They are causing reabsorption of calcium back into the body. So that is how they are acting. They are not allowing calcium to stay in the kidneys for a longer period of time. If calcium stays in the kidney for a longer period of time, then there are chances that it will lead to the formation of stones in the kidney. Drugs, they are also excreting, sorry, they are causing the reabsorption of calcium back into the body. Next, coming to the adverse effects. So in the adverse effects, it will cause anemia and hypomagnesemia. So in the body, it will lead to increase in levels of potassium, which might lead to weakness in the muscles. Hyperuricemia, uric acid levels will be increased, and hypomagnesemia, decrease in the levels of magnesium. Next, coming to oh my goodness. Okay. Next, coming to the potassium sparing diuretics. So from the name you can understand that these drugs spare the potassium ions. So they do not produce hypokalemic effects. So they are not allowing the potassium ions to be excreted in the body. So they decrease the potassium excretion, whereas they increase the excretion of sodium. So sodium will go out of the body, whereas potassium will be reabsorbed back into the body. So that is why they are not causing hypokalemia. So the amount of sodium excretion and potassium retention is less when they are given alone. But when they are combined with other diuretics, then it has the ability or capability to inhibit potassium excretion. So other category of drugs, if they are excreting potassium from the body, then potassium sparing diuretics, if they are given together with that category of drugs, then what will happen? The excretion of potassium will be stopped by potassium sparing diuretics, and the other diuretics will also cause increase in the urination. It is used to prevent hypokalemia, which is produced by other diuretics, that is thiazide and loop diuretics. And it is also an antagonist of aldosterone. So what is aldosterone and why is it an antagonist of aldosterone? So spironolactone is an important drug of potassium sparing diuretics. Spironolactone is an aldosterone antagonist. So these block the absorption of sodium, which encourages water loss. So aldosterone basically helps in the reabsorption of sodium. If sodium is present in the body, water retention will be there in the body. That is why for people who have blood pressure, the doctor says not to take salt because salt contains sodium ions. So this lead, what will happen if the drug is an aldosterone antagonist? Sodium will not be reabsorbed in the body, it will be excreted, which also leads to the excretion of water from the body and leads to decrease in the blood pressure and reduction of accumulation of fluid in the body. Coming to adverse effects, hyperkalemia will be seen if it is given alone. Acidosis, headache, drowsiness, confusion will be seen. Anti-androgenic action. Gynecomastia and impotence will be seen in males and menstrual disturbances will be seen in females. So all these things, if higher doses are given, these things will be seen. Hyperkalemia also, it is seen in the body when it is given alone in high doses because it is not causing excretion of sodium. So sodium gets accumulated in the body. So any drug, if it is given in more than what is required, then adverse effects takes place. The last category is osmotic diuretics. So the drug of choice in osmotic diuretics or the prototype drug is mannitol. What is the mechanism of these diuretics? These diuretics are different when compared to other diuretics. Depending upon the mechanism also and the amount that is needed. It is usually given by IV infusion because it has very poor absorption when given by oral route. So what is the mechanism? Why it is different from other type of diuretics? Because it acts by the mechanism of osmosis. So it increases the osmolarity of extracellular space. So what will happen? Water will be flown, extracted from intracellular, that is inside the cell, to outside the cell to equilibrate the osmotic pressure. So water from high concentration area flows to the low concentration area to make it equal, to make the osmolarity equal, and thereby this water from the cell, the entire water, it flows out of the cells to maintain a balance between the cell and the extracellular. Thereby, it decreases the intracellular volume of the water. It is used in the treatment of glaucoma. It is used in the treatment of increased intracranial pressure, that is increase in the pressure in the brain, and it is also used in brain edema. Adverse effects are the redistribution of fluid from intracellular to extracellular usually causes electrolyte imbalance because there is no proper mechanism. The salts and the ions are not balanced. The water is just flowing from high concentration to low concentration. So it might cause pulmonary problems. It might cause electrolyte imbalance, dryness of the mouth, vascular status, sorry, cardiovascular status must be checked because it might cause congestive heart failure. So these are the different types of diuretic drugs: osmotic diuretics, the thiazide diuretics, potassium sparing diuretics, loop diuretics, and carbonic anhydrase diuretics. The next class are the cardiac glycosides, which we will continue in the next lecture, because next two lectures, the part 2 and part 3 of cardiovascular system, are little small. So for today, this will become a very big lecture for you. So the first lecture about the cardiovascular system, the part 1, is still on diuretics. In the next class, we will continue with the cardiac glycosides and other category of the cardiovascular drugs.